Q1. What is the maxillary labial frenum, and why is it clinically significant in denture fabrication? A1. It is a fold of mucous membrane in the upper midline. It must be relieved in the denture to prevent dislodgment during lip movement. Q2. What anatomical structure lies between the maxillary tuberosity and the hamulus? A2. The hamular notch. It helps determine the posterior border of the maxillary denture. Q3. What is the vibrating line, and what is its clinical relevance in complete denture construction? A3. It is the junction between the hard and soft palate and marks the posterior limit of the maxillary denture. Q4. What is the function of the posterior palatal seal area in maxillary dentures? A4. It enhances retention by creating a seal and lies in the compressible tissue at the posterior third of the hard palate. Q5. What is the incisive papilla, and how is it used as a landmark in denture design? 5. A small raised area behind the central incisors. It guides the placement of anterior teeth in the midline. Q6. What are palatine rugae, and should they be considered in denture fabrication? 6. Ridges in the anterior palate that may aid in speech, but are not major support areas for dentures. Q7. What is torus palatinus, and how should it be managed in maxillary dentures? A7. A bony prominence on the midline of the hard palate that may need surgical reduction or relief in the denture base. Q8. Name the 3 mandibular support structures important for dentures. A8. Residual alveolar ridge, external oblique ridge, and buccal shelf area. Q9. What is the retromolar pad, and why is it essential in mandibular denture construction? A9. A triangular area of thick mucosa behind the last molar. It helps with denture extension and determining the occlusal plane. Q10. What is the buccal shelf, and why is it a key area in mandibular dentures? 10. A flat area on the mandibular arch that serves as the primary stress-bearing area. Q11. What is the role of the mandibular alveolar ridge in denture construction? Q11. It provides support, but may resorb over time. Accurate impression taking is necessary. Q12. What is the torus mandibilaris, and what consideration does it require during denture making? A12. Bony growths on the inner surface of the mandible near premolars that may require relief or surgical removal. Q13. Where is the sublingual caruncle located, and why is it important? A13. It is under the tongue and marks the opening of the submandibular salivary duct. Care must be taken to avoid pressure in this area. Q14. What is the lingual frenum, and what must be considered when designing mandibular dentures? A14. A fold of tissue that connects the tongue to the floor of the mouth. The denture must allow free tongue movement. Q15. What are the anatomical borders that influence denture flange design in the mandible? 15. Labial frenum, buccal frenum, lingual frenum, retromolar pad, and the mylohyoid ridge.